Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide this week's update on the COVID-19 pandemic for the week ending December 24th. As I'm recording this after Christmas, I want to wish all of you a very Merry Christmas and a happy holiday. And however you and your family choose to celebrate, I hope you have a happy and healthy holiday season. And I hope that 2021 is your best year yet. As always, I'm going to divide my talk into three parts: growth of the global pandemic, cases, hospitalizations, and deaths in the United States, and the status of the pandemic in our region. Globally, we've seen now 1,750,000 deaths. This is an underestimate because we have underreporting. Almost 80 million cases and a 4.8% week-to-week increase in the past week. We follow this week-to-week increase because it tells us how rapidly the pandemic is growing, whether it's slowing down or spreading. Obviously, in the early months of the pandemic, we saw very high week-to-week increases, some cases doubling the number of deaths in a week. And then as of early May, it's been below about 10%. And it seemed to be coming down until early to mid-September. And you can see then we had this 3.5% to 4% growth rate. Unfortunately, that didn't last. In the last 6 or 8 weeks, we've been running 4.5% to 5%. At 4.8%, we would expect to get to 2 million deaths worldwide in less than 3 weeks. That's a pretty significant number. Early in the pandemic, obviously it started in China, as far as we know, but early in the springtime, these deaths in green were in Europe, followed by a summer, most of the deaths in the Americas, North and South America, and then the last couple of months resurging in Europe. When we've been following this pattern in Europe, where they had this spike in deaths, daily deaths, in March and April, we saw it, and these are the 4 most impacted countries in Europe: Belgium, Italy, Spain, and the United Kingdom. And then they saw relatively few cases over the summer. And then in the last couple of months, we've seen a second spike. In most cases, the second spike appears to be lower than the first, which is good news. It appears to be a little bit broader, meaning it lasts a little bit longer. And in all cases, it seems to be coming down, with the possible exception of the United Kingdom. And we want to keep an eye on this to make sure it's not just a temporary rise, and whether it might be related to the spread of a mutated virus in the United Kingdom. We simply don't know. But we're going to keep an eye on this pattern. In the U.S., we follow cases and then hospitalizations and then deaths. In terms of cases, this is where all the cases have been in the U.S. in the past 2 weeks. These numbers are huge. Southern California and the Southwest quite a bit. Some resurgence in the Rust Belt in the U.S.-Mexico border region. But obviously right here in our region of Tennessee, just a huge number of cases. And the media has had a number of reports about how Tennessee is the current fastest growing part of the country. If you look at daily cases, we saw a spike in the springtime. We saw a second spike in the summer, consistent with that number of deaths in the Americas. And then this huge spike in cases the last couple of months. Fortunately, it appears to be leveling off and perhaps coming down. But again, I'm not a big fan of cases because it depends on how many tests we do. So we look at hospitalizations. This is cumulative hospitalizations. And what you can see in the last week, it's grown 4.1%. Again, having come down, came down fairly significantly until September, and then it appears to be coming back up. Hopefully it's leveling and coming down. We're going to keep an eye on it. That tells us, though, that the pandemic is still growing overall in our country, and we see the same pattern with deaths. So far, the U.S. has had 337,000 deaths. And you can see the cumulative number, and you see this little, it looks like the angle is sort of arching up here a little bit. It's straight, and then it's increasing, and we certainly see that in the week-to-week growth rate. Here's the total number of deaths. We saw a spike in deaths in the springtime, a spike in the summer, and now this third spike here. Now, for us, this third spike is bigger than the first, and it does appear to be at least as broad as the first. So something to keep an eye on. In terms of week-to-week growth rate, 5.6%. Again, after coming down for quite a while, from September on, it seems to be coming back up. That tells us that the pandemic is still growing overall in the states, even if there's some places like our state that are worse than others. At 5.6% week-to-week growth rate, we'll get to 400,000 deaths in a little less than a month. That's really significant. And it's always worth stopping and remembering that we're talking about people losing their lives. This is not a political issue. This is a major public health problem. In terms of our region, the number of deaths in each of the states in this area doesn't tell us a lot. But if you look at the number of deaths per million, you can see that Virginia, North Carolina, and Kentucky are all fairly similar. And Tennessee's about 50% worse than them. So certainly something to think about. In terms of Virginia, 5.2% increase in the past week, pretty much like the rest of the U.S. Virginia's had this sort of roller coaster look, but it does appear like the rest of the U.S. that it's been increasing in the past month and a half. In terms of where the cases have been, again, in the West and Southwest, and our region especially, Tennessee still double-digit week-to-week growth rate, where it has been for a long time. This is really significant. At 10% week-to-week growth rate, we'll get to 10,000 deaths in less than 5 weeks, and we'll double in about 7 weeks. I want you to think about that. Think about all the deaths we've had in our state. We're going to double in less than 2 months unless we do something pretty significant. And where the disease is in the state is, of course, all over, as it has been the last few weeks. In terms of hospitalizations, again, cumulative hospitalizations are going up. And you can see the pattern, in the summertime, the percent week to week was coming down. And then from September on, it seems to be increasing and going up. So again, as I've said before, the interpretation here isn't that somebody is necessarily doing something wrong. I think the interpretation is whatever we're doing isn't working. And if we really want to make a difference in this pandemic, we have to think about things that we can do differently. If you look at our region, again, still a hotbed with cases in Virginia, North Carolina, and Northeast Tennessee. In the Ballad catchment area, we've had over 1,000 deaths and 11.6% week-to-week growth rate, so even worse than the rest of Tennessee. At this rate, we'll double the number of deaths in about 6 weeks. I want you to think about that. Twice as many deaths as we've already had in the next month and a half. So the bottom line is there are 2 vaccines available, but depending on how many doses get out and who gets it, we're still going to look at several months optimistically before we see a significant change in the spread of SARS-CoV-2 in our country. And remember, even if we can get to herd immunity here in the States, we're still at risk from imported cases coming in from other countries. So it's important to get vaccinated here, but also to support distribution of vaccines around the world. The pandemic continues to spread around the world, growing at slightly more than it was a month and a half to 2 months ago. We've been watching this spike in Europe, glad to see that it's coming down. The second wave, it's crested, with the possible exception of the United Kingdom, where a mutated virus appears to be spreading. The U.S. has now passed 1,000 deaths per million, with a growth in virtually all areas, but Tennessee and our region are both among the hardest hit in the country. And so until a vaccine is available and widely distributed, there's really nothing we can do but what we know works. Right? So avoid crowds. Obviously, this is a virus that spreads from people to people. If you're not near people, you won't get infected. If you are going to be near people, passing people, walking by people, wear a mask. The evidence is very strong that mask wearing can help reduce the spread of the virus, especially if you engage in social distance. That means be as far away from people and be near them for as little time as possible. Implement good hygiene. All of these things, by the way, are going to help us in the future, even after COVID is gone. Every flu season, these will be helpful to us if we engage in these things. Stay home if you're sick. If you've got a virus of any sort, and a respiratory virus, and you go out, you're going to expose other people. So err on the side of staying home. We have to conduct widespread contact tracing, widespread testing and contact tracing. I think when the history of this pandemic is written, this will be one of the areas that we get criticized for, that we didn't produce tests quick enough that could diagnose infection and help control spread, and then lead to quarantine and isolation. We still have to remember that this is a disease that primarily kills folks who are elderly with chronic conditions. Not everyone that dies has this, but many of them do. We need to protect them. And especially, I think the lesson we have to learn is we have to treat each other with greater kindness and respect. It is perfectly reasonable for people to disagree. But when the facts lead you one way or the other, it's time to set aside our political, historical differences and say, this is not a political football. This is a public health challenge, right? Public health is public, and health is what we as a public have to do. We have to deal with this together, and it starts with greater kindness and respect. As always, there's a lot of COVID information on the College of Public Health website. If you know anyone who'd like to be added to this mailing list, please let us know. I'd like to thank Dara Young for editing, producing, and posting this video. And as always, if you have any questions, comments, criticisms, concerns, please let me know. That helps me understand whether what I'm saying makes sense to you and also where the unanswered questions are. I try to answer a lot of questions offline through email, but I'll also add some to this video presentation in the future. So again, I hope that you have a wonderful holiday season. I hope that 2021 is a better year. In fact, I hope it's your best year yet. Thank you very much.